This day after a Bills loss. Nobody's in that great of a mood today, but we're certainly excited by the announcement that the county and county executive is going to be making here this morning. Before I add a few more words, I just want to introduce all the people who are behind me here. Okay, we're joined by County Executive Mark Poloncarz, Deputy County Executive Lisa Shamara, Erie County Legislator John Barnese, and Erie County Legislator Mike Kashowian, as well as our Commissioner of Health, Dr. Gale Burstein. I'm also joined by my colleague on the Tonawanda Town Board, Carl Zarek, and Superintendent of our Youth Parks and Recreation, Mark Campanella. And the Kashowian girls over here behind me here, twins, who were born coincidentally like 2 weeks before the pandemic hit. So easy to remember their birthdays. So that's good. Well, welcome. AEDs, as we found out last year, earlier this year with Damar Hamlin's situation in Cincinnati, are lifesavers. And we are taking an effort on the town level, but we're thrilled that the county is going to be donating these AEDs to the town for our use here at our Aquatic and Fitness Center. And they are, along with CPR, they save lives. And the town in particular is going one step further. We are right now trying to coordinate a system where the public will know where all the AEDs are that we have in the town are, where at all our facilities, and we're working our way through that process. So I do want to just say I forgot one group of people standing behind me, and I should have done them first, and that's our internationally renowned Tonawanda aquatic aquats who are joining us today. I apologize for that. So without further ado, I'll turn it over to County Executive Mark Poloncarz.
Thank you. Thank you, Mr. Supervisor. It's good to be here. Good to be here with the Aquats and the Titans as well at the Town of Tonawanda Aquatic Center, one of the jewels of our region, as we fulfill an announcement that I made earlier this year at the State of the County, in which the county would be purchasing and donating to various organizations AEDs to ensure that if the worst case situation ever happens, people can respond. I was a hockey coach for nearly a decade, and my biggest concern whenever I coached was injuries, not wins and losses, it was injuries, because when you're coaching youth, the last thing you want to see is an injury. But there were two ones that scared the heck out of me that could, if they occurred, on my watch as a coach. One was the terrible idea of a skate hitting a child in the neck or something like that. And the other one was a cardiac event on the ice, which has happened before. Thankfully, when I coached, I never had to deal with that. But I know it had happened before in our state, in our country, often when a puck would hit a child in the chest. And then we saw it all with our eyes last year in that fateful game in Cincinnati when Damar Hamlin made the tackle, and unfortunately, because of the force of the tackle, had a cardiac event. And he was saved because of the professionals that were there that could immediately respond, but also because they could provide him immediate care with an AED on site. And unfortunately, there are too many places in this country where individuals could have cardiac events where we do not have AEDs on site. When I was coaching hockey, I would go to the rink and I would look to see, do you have an AED? Where is? Because if you need to respond, you have to do it immediately. You can't be searching a rink, you can't be searching an aquatic center to find out, do you have an AED on site? Because every second matters. And that's why I'm proud to work with our partners in the legislature, represented today by legislators Barnese and Kashowian, to have acquired 118 AEDs for distribution all across Erie County. As I noted, this was announced as an initiative that I wanted to see move forward on our 2023 State of the County address, and the legislators obliged is the best way to put it. We all realized that this was a no-brainer. This had to be done. And so money was put in from the close of the 2022 budget. There was enough money to purchase AEDs. Of course, our Department of Purchasing then goes out and puts out bids for AEDs, and we got really great prices on AEDs, and now they're being distributed all across Erie County. Our office has been contacting town recreation departments and youth leagues across Erie County to compile a distribution list with 60 that have already been allotted to various youth facilities, including what we see here in the town of Tonawanda. We want these devices to be available in other places as well. We've worked with organizations as varied as churches, to the Elma Rod and Gun Club, the Buffalo Black Nurses Association, and the Kevin Guest House to ensure that places where the public goes to have AEDs. And I'm very proud that we were able to do this in a very fast amount of time in a very short and limited amount of dollars that are actually being spent. This was an investment of $220,000. Erie County's budget is fairly large. It's going to be nearly $2 billion for the 2024 budget year. So for $220,000, we were able to purchase approximately 120 AEDs and are going to get them all across Erie County. It comes down to this, as I noted, in a cardiac event, every second matters. And the nice thing about these AEDs is they have the ability to walk a person through the actual process of putting it on an individual and telling them what to do. These aren't the old AEDs where you had to be an emergency medical technician to understand how to use them. These can be used by anyone because they actually talk to you and tell you how to move forward with the process to save the person's life. And I'm very, very thankful that we've been able to move forward in a fast time to get this done. So thank you to all, including our Health Commissioner, Dr. Gale Burstein, for advocating for these AEDs to be distributed across our community. All libraries have already received one. As I noted, 10 have been distributed to African American churches on Buffalo's east side. 5 were distributed to the Buffalo Black Nurses Association, 2 to the Kevin Guest House, 1 each to the Elma Rod and Gun Club. Our Botanical Gardens, owned by the County of Erie, did not have an AED beforehand, but we know it should because it has lots and lots of people who go to there every year, as well as the Gloria J. Parks Community Center. I want to thank all our partners for their efforts to ensure that these AEDs are on site and that their staffs are also trained in how what to do in a situation if one is necessary. And to each and every one of our partners here, especially Supervisor Joe Emminger, Councilmember Carl Zarek, Director Mark Campanella, thank you for opening up your house today, but also for ensuring that these life-saving AEDs are in place in Tonawanda facilities in case the worst situation happens. Nobody wants to go through that situation, but it is always better to be prepared for the worst and hope for the best that it never occurs. But if the worst occurs, you need to be prepared. And that's why we are prepared by ensuring that these AED units will be in facilities all across Erie County in case the worst situation happens. With that, I once again thank our partners in the Erie County Legislature, represented by Legislator Kashuian and Barnesi, who are here today, and invite Legislator Barnesi to say a few words. Thank you.
I just want to echo what the county executive said. By his leadership and putting this forward and bringing this up in the state of the county, this is actually, County Executive, our second round of funding for this community in your budget. We distributed AEDs to the police and to the fire departments, and now to our recreation. So I want to thank you for budgeting that into and allowing these funds to go through and thinking of our community. Dr. Gale Burstein, thank you very much for your leadership on this. Without these two people and putting the AED program forward, we would be without them, and all our community would be without them. So I'd just like to thank him and his leadership for securing the funds for our community. So thank you very much. Next up is Dr. Gale Burstein.
Thank you. Well, I am so glad to see these life-saving devices being distributed to youth sports programs, libraries, and community organizations that have a strong public impact. So as a pediatrician, that I know that there are cardiac conditions that present without warning in children's and adolescents. And when you have a large group of young athletes, coaching staff, referees, spectators together in one place, if some sort of injury or cardiac event occurs, there's an extra level of reassurance knowing that an AED is close by and can save lives. So with that, we encourage everyone in Erie County to get trained on the basics of first aids and hands-on only CPR, and also stop the bleed. So we can all know how to help help our people in our community, our families and loved ones that have a serious event until emergency response arrives. So with that, I am going to introduce Councilman Mark Zarek, who is chairman of Youth Parks, Recreation, and, Carl Zarek, sorry. It's Carl Zarek, chairman of the Youth Parks and Recreation Committee. Sorry about that.
Yeah, thank you, Doctor. Yeah, and thank you, County Executive, for all you've done for us here in Tonawanda. And this is important because Tonawanda still is known for all the recreation opportunities that we have here in town. You know, whether it's here or our new ice rink that we're building. And at the ice rink, we're going to have seating for 600. There's seating for a couple hundred here. So it's the spectators also, the parents and the grandparents, that this is important for. And we want to thank you for all that. It's just not about the sports and rec, about the visitors that come into town, come in and are in the neighborhood here. So thank you very much for that. Thank you all you do for the rec program in Erie County and especially here in Tonawanda. We got a lot of great projects going on, and this is going to be safety for all those projects, and we appreciate that. Thank you very much.
Thank you. Thank you, Carl. This is, as I said, is a community effort. We are distributing them all across Erie County, any location where there are people that go. Primarily, we're addressing issues with youth sports. We know how important it is, and we know that Damar Hamlin himself is ensuring that youth sport organizations are getting AEDs. We need these defibrillators across our community to ensure that if the worst-case scenario happens, people can react and respond. And I just thank everybody here for the work that they've done to make it a reality as quickly as we were able to get it done. With that, we'll take any on-topic questions from the podium here. Are there any on-topic questions?
Training? Will there be training for the staff? What's the plan for that, or program for that?
There will be, so that staff understand basics of how to use it. As I noted, the actual device itself can talk to you and let you know how you had to respond. So in case staff is not available, but they know that the defibrillator is there, that anyone can use it. That's the advantage of these compared to the old defibrillators that you had to be basically a trained paramedic or an EMT to use. We have these same defibrillators in County Hall in the Rath Building on every floor, and if the worst case situation arises, someone who's never used one or even touched one before can at least respond because they have the capability through these AEDs of giving the information that's necessary so that it can be used properly.
Is enough? Do you want to get more, or what's the future plan?
Well, we are seeing what the need is in the community too. You don't want to buy too many and having them sitting on a shelf where they're never going to get used. I think the goal is to ensure that we reach out to all the youth sports organizations, community organizations that do not have them. Many already do, so it's not like that this is the first time this has ever been done. Many of these organizations do, but not all do. And we think it's important to ensure that we hit the ones that we know haven't been touched yet. And if there is a greater need in the future to purchase more, we can do that. We just need to know exactly as we go along in the next few weeks what the true need is.
So not only protecting the athletes, like Carl said, but the spectators, older people watching, like young kids. Right?
Correct, and it's not uncommon for an incident to occur. I can tell you just from going to our football games at Highmark Stadium, one of the most frequent calls that is received by our emergency personnel there are people who are having a cardiac event, and it's not always like what we saw with Damar Hamlin on the field. It could be a fan. I remember last year a gentleman was going to the restroom and walked into the restroom at Highmark Stadium and fell over. And people immediately realized he was not drunk, but was having a cardiac event, and they were able to save his life. And that's great because we have hundreds of trained personnel that are at the stadium on any one day. But when you're at a facility like this or other types of facilities, you may not have any trained personnel, and you just need to have someone there who can react using the device. So this is going to save lives, we believe, in the long run. And if this $220,000 investment saves one life, then it certainly was worth it. Nevertheless, whether it saves multiple lives over the years of usage.
Anything else, guys?
Well, Dr. B, are these adult and cardiac, or child, how does that work, you know? Is it?
Yeah, they are able to work on, people, children, all the way through our older adults. So just to keep everybody safe. And, as your colleague pointed out, we're not only worried about children and adolescents, we're worried about older adults who come and accompany their children and grandchildren to watch these sports activities. And, you never know when something's going to happen. So it's really important that we have these on hand, anywhere. Thanks.
Okay, thanks, everybody.
Bring
We'll
our
see you.
quads
Maybe
up.
we'll put them up or something, show it to us.
Why don't you bring the quads up?
On executives.
Yeah, come
Show
on.
us what's inside the kit. Yeah, get it right.
We're not going to test it out.
We have two Titans over here.
All right. That's it.
Dr. Burstein, come on. Let's take a look inside.
In a little color.
It actually,
We're kind of, without having to, being able even to read, you can sort of figure out exactly what needs to be done. So you just, open it up, take off the shirt, and then you would rip off this pack and you would get to the things that are underneath it. I don't want to rip.
Right, we don't want to open
We
it
don't
up.
wanna open it up.
Right, but it's pretty much self-explanatory. It's really, these are made for people that don't have any experience in first response or medical care. Because really, that's the most likely scenario. Most typically, you're gonna be in a place and, call for a doctor or nurse and nobody's available, and this can save people's life. It walks you exactly through what you need to do, where you need to put the probes. And then once the probes are placed, it tells you, what's going on and if you need to activate the machine or not. So they're, really life-saving.
You see the power button, but also there's a little button with like a little baby, a little toddler. So it tells the machine you got a little one.
Thank you.
Yeah.
Thank you, everyone.
Thank you. Thank you.
Thank you.
Thank you.
Could you grab a picture of the quads?
Sure.
Yeah.